Okay, well, welcome back to Coffee with Krav. As a reminder for those of you watching this for the first time, we started this Coffee with Krav during the pandemic to be closer to you, to bring interesting guests from all different walks of life. Today is December 1st, and it's the start of the holiday season. And first and foremost, I want to show gratitude to our clients. We had started this Coffee with Krav exclusively with our clients, and I want to thank all the clients of Align Wealth. Thank you for your friendship, your loyalty throughout the years. We've then now expanded Coffee with Krav to others. So I want to thank all the viewers of Coffee with Krav. This has been a very trying year, and I really wanted to give my heartfelt appreciation to my fabulous team at Align Wealth. I also wanted to appreciate my family, my wife, my friends, and just one personal thing that I did want to say. Since our last Coffee with Krav, a childhood friend of mine had passed away, and it was another reminder that we have to be thankful for the life that we have, thankful to the people that we have around us, and use this season to thank the people that are around you that you care for. Okay. Let's talk about today's guest. I am really thrilled to have Dr. Gary Sherman, who's going to talk about his experience with congestive heart failure, also with so much going on in New York. With Gary is part of the New York COVID testing, contact tracing initiative. So we're going to get into that. So let me read his bio. Dr. Gary Sherman has had an astonishing career, which includes 36 years of practicing cosmetic and restorative dentistry in New York and Long Island. Dr. Sherman was also the president of Pursuit's Professional Business Consultants, where he was formally trained expert in business valuation. For the past 22 years, Dr. Sherman has been living and thriving in the face of heart disease and has recently received a left ventricular assist device, which is a electromagnetic pump attached to his heart, which helps his heart to pump blood to the rest of his body, which is obviously essential to his survival. While he waits the gift of heart transplant, Dr. Sherman has used this time for extensive technical and didactic research in cardiac disease and current treatment of modalities, while drawing on his own personal experience as a patient in the healthcare system. He is a keynote speaker on congestive heart failure from the vast amount of cutting edge information, visual creation, and emotional personal stories that spring to life. In response to the coronavirus pandemic that we're facing today, Dr. Sherman has taken on the role of team supervisor for the New York State Contact Tracing Initiative. This initiative was designed to manage the containment of COVID-19 pandemic that has gripped our neighborhoods and our country. Wow. Okay. So, Gary, let's start back to your childhood. You grew up in Long Beach, right?
Long Beach, New York. Yeah, Long Beach on the beach. Everybody seems to like Long Beach these days. It's an alternative to going out to the Hamptons, and the beaches are beautiful in Long Beach. But yeah, I started out, my first job was cleaning those beaches.
Oh,
I was probably 11 years old, and for $1.56 an hour, I would wake up 5:30 in the morning. I think the shift went till 11 a.m., and I would clean the beaches. So that was my first job, and I don't think I've ever stopped working since. So
well, that's
uh,
a so in Jones Beach, you see those people with those machines that can detect coins, right?
yeah,
You weren't one of those guys that were detecting coins and
no,
pulling.
we dragged the basket on a string. I mean, it was real simple, and we had to pick up everything with our hands. I'm pretty sure we didn't wear gloves in those days either. Times have changed, you know.
Oh,
Oh,
absolutely.
I'm probably going back 50 odd years. I hate to say.
And who was your hero growing up?
Wow, that's a great question. Who is my hero? In sports, it was Mickey Mantle when I was a kid, I guess. You caught me by surprise with that one. Inspirations, I took a lot of times from the people who perhaps were my teachers. But, I think learning along the way, I think I took lessons from everybody that I came in contact with and tried to grab the best of it. Growing up, my father worked 2 jobs. I really didn't see him much. I think a lot of people would suggest that their father was their hero. And certainly I loved him very much, but I didn't really have much contact with my father. He was working a lot. My mother really raised me for the most part, and she was working too. So maybe she was my hero. She's still alive, by the way, at 89 years old and on her own. So we're blessed by that. She's doing great. So maybe I have never thought of it that way, but maybe she was my hero in the long run, at least at that time.
Moms are all
Yeah.
moms are heroes. All moms
Yeah.
are heroes. So you went to undergrad for psychology, but graduated at U of P, University of Pennsylvania, dental school. What made you change and go into the dental practice?
Yeah, it's an interesting question. I always wanted to be a doctor in one sense or another. I think going back all those years, we make decisions sometimes, especially if we're not necessarily guided by a particular person, a parent, or whatever. We make the best decisions we can. I always wanted to be a doctor, but I didn't like hospitals. So I said dentistry is perfect because I could be a doctor and not necessarily be in the hospital. I chose that. I think the psychology background certainly helps because we're dealing with people. Even to this day, that background has helped me. I've studied it further quite a bit. In my time as a dentist, I always studied persuasion and influence because I thought it was an important part of practice. A lot of times, especially in dentistry, we're dealing with people who who find excuses sometimes to not do the things that are probably in their best interest. And so trying to get them to understand the importance of what we were trying to do for them, the persuasion and influence was an important part of that for me, and it helped. So those things that I studied, Cialdini and some of these other authors in persuasion and influence, were always a part of my repertoire, so to speak.
That's interesting. And about 12 years after graduating, you had your first open heart surgery. How old were you, and was that a surprise for you?
Yeah, no. So a little more. Let's do the math. I graduated at 26, right? So I was 42. 42 years old. 2 kids, 10 and 5 at the time. Two sons, and I had a full-time practice. I might have even been starting to coach soccer at that point, and I noticed some lower backache. And I had a friend who was a chiropractor. I went to him first, and he gave me some remedies, and it wasn't going away. So I decided to call a physician off of my insurance list, and assuming he was going to refer me to an orthopedist. Maybe I slipped a disc doing dentistry. It would be understandable if that were the case. Long story short, when he did the chest x-ray, he found that he didn't see anything wrong with my back, but he said my heart was enlarged and I should see a cardiologist right then and there and not to wait. And that afternoon, I made an appointment with the cardiologist that was treating my mother and father at the time. My father was alive at that time. He died at 89 too, by the way. So I went to the cardiologist and he said, you have an enlarged heart. I went directly to, I guess he had a little operating room where he was able to figure out with a transesophageal echocardiogram that I had a valve, the aortic valve, that stopped working. So it was a fused valve, congenitally fused valve. Most of the time the valve has 3 leaflets. Mine had 2 fused, so I only had 2 leaflets. When you have that congenital disorder, it's around 40 years old or 42 where it starts to break down. And indeed it did for me. My first open heart surgery then took place a week after that, perhaps even less, a few days after that. And I had the aortic valve replaced with a natural valve. I was 42.
So just to cut in there for just for a second. So I think that there's a misnomer that about heart disease, that heart disease and heart issues are only for the elderly. It doesn't seem that way, correct?
Yeah, no, obviously for me, that was not the case. And we see, it's interesting that you bring that up because there's a video that showed up on my Facebook today of a 19-year-old who just got a transplant at my hospital this past couple of weeks. So he's a dancer. And there is a video on Facebook about that story. 19, congestive heart failure, which I later developed, can hit anybody at any age. It shows up often postpartum in young women that have given birth, and all of a sudden and what it is most of the time is the loss of the function of the left ventricle. So it's mostly left-sided heart failure. And when that happens, your body can't pump enough oxygenated blood to the rest of your body so that you can function normally. And the symptoms will be difficulty breathing, difficulty lying down to sleep most of the time, difficulty walking up hills. You get out of breath. And that's the initial symptom that gives you an idea that you might have congestive heart failure. And it does affect people of all ages.
Well, in 2007, you had your second open heart surgery. And then 2017, you were diagnosed with congestive heart failure.
Right.
I'm sure a lot of people like me don't know the exact definition of congestive heart failure. Can you help me and help others out? What's the definition of that?
So and congestive heart failure is misunderstood, of course, all the time. It's not a heart attack. I've never had a heart attack. In fact, I've never had a chest pain. It's usually the failure of the left side of the heart. It could be right side, but it's usually the left side of the heart. And congestive heart failure is when the left side of the heart can't push enough oxygenated blood to the rest of the body so that we can function normally. That's the definition. The medical definition is when that efficiency, called an ejection fraction, that's the fraction of blood that's being pushed out from the heart each time the heart beats, which is 90,000 or 100,000 times a day. For most people, it's 55 to 70%. Congestive heart failure is defined as 35% or less. Mine went down to as low as 24%.
Wow.
So so maybe my first at first 5 years ago, my congestive heart failure, I probably was at 35, and that progressively got worse and worse. Congestive heart failure does not improve, generally speaking, unless there was some kind of injury to the heart that they can reverse. Most of the time it's progressive and it just gets worse. When it got down to 24, I couldn't walk from here to there. So I was managing it for several years on medications under the supervision of a cardiologist in heart failure. But then it got to the point at the end, 2018, late 2018, where the medications were not doing the trick. And then I was told at that point I would need a heart transplant.
Okay, I definitely want to get to that,
Yeah.
and we will get to that in a second. But I just want to stay on congestive heart failure for a second. I read somewhere, and let me know if this is true, that 1 in 4 people will get congestive heart failure at some point in their life. Is that true?
That's true. And of course, the majority of those people that can get congestive heart failure are older people. But I would say it's about 20% of those people are 50 years old or less. So wow. There's a significant percentage of those people. So we're talking about 6.1 million people in this country that have it now.
Wow.
So it's, And what I noticed as a speaker on congestive heart failure, which is a career that I took on, because I wanted to spread the word really about this disease, because very few people understand it, just like we're explaining now. And not only lay people, but even doctors are really not understanding congestive heart failure as well as you might think, except for those who are specialists in it. And I include cardiologists in that too. They don't really deal with people who have that serious a level of congestive heart disease. And so it's misunderstood. Yeah, so it affects many ages and it affects so many people at this stage of the game. So it's something that shouldn't be ignored.
As a reminder to everybody, if you have a question for Dr. Sherman, for Gary, you can email me, and my email is mkravitz, KRAVIETZ, at Align Wealth, ALINE wealth.com. So if you have a question at any time, I have my my Outlook out here, and you can just ask the question. And I'll ask Gary those questions. So what are ways? Are there ways to avoid or reduce heart disease?
Yeah, so I mean, it's all the usual ways that the American Heart Association certainly, suggests. And, we really do have to find the point at which we have to watch what we're eating. I mean, I think it's the most important thing is what we put into our bodies. I have not, in my lifetime really followed those rules. I ate everything and, enjoyed my life like most of us, going out to restaurants and all that. But I think that what we put into our body, especially as we get older, is a significant part of it. Exercise, taking the medications that are recommended. I think a checkup with a cardiologist is really important. I think things can get overlooked. And I will say specifically and particularly for women, and I bring that up because the symptoms in women for heart disease are different than in men, and sometimes they are misdiagnosed.
So I just want to bring up, that was going to be my next question.
Sure.
Gary is a keynote speaker, and he has a presentation called Gender Matters: Why Women Are at an Even Greater Risk for Heart Disease Than Men. So before I got involved in American Heart Association, I always thought it was older men that got heart attacks, and that's what heart disease was all about. But then as I learned the facts that women could even be at a greater risk than men. So I want you to talk about that, please.
Yeah, so, heart disease historically, and this is going back hundreds of years, but more recently, was almost like a badge of honor. If we look 40, 50 years ago, for men, type A, running a business, and they got a heart attack, it was almost like a badge of honor. And women always thought, at least the perception was in the media and so forth, that cancer, breast cancer or such, was the issue for women. But 4 or 5 times as many women die of heart disease than they do of cancer. So, and it's overlooked in women because the symptoms are different, their bodies are different. For example, men usually will have chest pain associated with heart attack. Women will have lower back pain or jaw pain, or extreme fatigue. So, and usually they'll write it off to having too much stress. Their son is being bullied at school, for example. And so, and going into the physicians, they even suggest that to their doctors. And so the doctors sometimes dismiss the patient before they've actually done a workup. And the tests have shown sometimes when that workup is done that indeed the woman has coronary artery disease. So it's important for women to be empowered enough to suggest to the cardiologist and to their doctor that they should make all the tests to make sure that they don't have a heart problem.
So what would you suggest, at what age, either male or female, what age should you start going to a cardiologist?
So if you have heart disease in your family, that number would be lower. My sons have both been checked because I had heart disease, my parents had heart disease, and so in their 20s and 30s, they already made a visit to the cardiologist. A simple EKG, which is a simple test, they just put some, electrodes on you, and it's painless and easy and fast. But that could indicate a lot of things, point the doctor in the right direction if there is a hint that there might be heart disease. So I would say as early as that age. But there shouldn't be a fear of going to a cardiologist, just as a matter of making sure that there's no potential problem with the heart.
Makes a lot of sense. I'm going to come back to your story. The start of 2019 was extremely challenging for you, for life-saving operations and other open heart surgery, placement of the left ventricular assist device into your heart. If it's okay, can you talk about this experience?
Yes. So initially, I was being treated for congestive heart failure at Mount Sinai. And at Mount Sinai, I went through a series of tests to be able to get me on the heart transplant list. For one reason or another that I won't get into today, because it's probably going to take too long, that didn't work out there. And they decided that I was not a patient that they could treat. And so I went to my phone because I knew I needed a heart transplant. And I found a new program in Long Island at North Shore University Hospital that had just started in late 2017. So it was a brand new program. The doctor running that was Dr. Stevens, and Dr. Lima was brought in from Texas as the cardiothoracic surgeon. He had done 4,000 procedures there. And so they created a program for Long Islanders, because most Long Islanders, if they had a situation like me, we had to go into the city. And now we didn't. As it turned out, North Shore University Hospital is 6 minutes from my apartment. So it's wonderful. But so I went in there, and they did a workup on me, and I had to still sell my dental practice. And that was an interesting time, because my health was deteriorating. I asked them to give me a medication that I could go to work with that would allow me 2 months to be able to transfer my practice. And long story short, that worked out. I had a medication that was in a pouch that went through an IV attached into my shoulder, and the medication was being delivered to me while I was practicing. After the closing on my practice, we sold my practice, and I went to my car, and I called the administrative person at North Shore, and she knew my history. I'd already been hospitalized for the medication. And she said, did you sell your practice, Dr. Sherman? I said, yes, I did. And she said, go home, have some lunch, and at 2 o'clock, I'll call you about 2 o'clock when your bed is ready. And that same day, I was admitted, I was in the bed, and at that moment, they were looking for a heart for me. Looking for a heart, and again, I suppose I don't want to step on your questions about that process.
No, keep going.
But I will tell you that that has to be done fairly soon when you have congestive heart failure. They kept me alive on an ECMO machine, which is a heart-lung machine. Mm-hmm. They had done some other operations first before I was on ECMO, just to keep my heart strong enough for the process. When that wasn't working, I went on the ECMO machine, which basically was that's your last step before you get a heart, or in my case, an LVAD, which it turned out being. So I was on the heart-lung machine, and after about 6 days, Dr. Lima came in the room and he said, I have a heart for you. So everybody got excited. We all went to the operating room. They packed me up. I was going to get a heart. And we all went to the operating room, and I laid on the table for about 2 hours. And then Dr. Lima came over to me and he said, we decided we're not going to do this operation. The heart that we had chosen was examined by our team, and it's shown that the quality of the heart is not good. So I was sent back onto the heart-lung machine at that point. Everybody was quite disappointed, especially my wife, as you might imagine. You know, we get excited about the prospect of getting a new heart and a new life, and that was disappointing. About 6 days after that, Dr. Lima came in my room again, and he said, I have another heart. We packed up again. At this point, I know the prep team. I know everybody. I know the anesthesiologist. They're all my friends. We did this last week. We went in again, and this time they put me to sleep. The heart was good. And when I woke up, I was staring at the heart-lung machine. I was looking at the ECMO machine. I looked at the ECMO machine. I said, what are you doing here? If I got a heart, I wouldn't need you.
Right.
And it turned out that right before the operation, they do a transesophageal echocardiogram to make sure that the body is ready to receive the heart. They found a tear in my aorta, and they had to bring in a specialist to graft the aorta, and they had to postpone that operation. And again, that was 2 times that a heart transplant for me was aborted. At this point, um, while they waited a few more days, my condition was deteriorating. My kidneys started to fail. And so they decided that the only thing that they could do was give me a left ventricular assist device, which is a motor attached to the heart. Mine is called HeartMate 3. It's the newest iteration that is available. It's a motor attached to my heart, and there's a cable that comes out my stomach attached to a computer that controls it, and it's powered by 2 lithium batteries that I wear on my side. And that
Amazing.
LVAD is something that you could wear indefinitely for some people who, for example, are not eligible for a transplant, or sometimes it's a bridge to transplant. In my case, it's a bridge to transplant. I've had it now for just under 2 years.
And how long? You said it can last forever?
So the studies show that HeartMate 3 has not been out that long, but they suspect that it could last as much as 10 years, give or take. I always consider myself an outlier. I say, well, if it can last 10, it probably lasts 12 on me, but they still consider the heart as the gold standard. So while the LVAD I could certainly, in my condition now, if things were to stay the same, I would be fine living on this. But, the future is uncertain. Certainly something can go wrong with the device. And if it does, I don't want to lose my window to get a new heart. So I think in my case, quite frankly, I've made the decision at this point, having recovered again from my surgeries. And I needed that time to recover because I wasn't ready to go back in again, as you might imagine. I had 4 operations to save my life, 2 aborted heart transplants, and the LVAD placement, which was an open heart surgery, my 3rd. I wasn't ready to go back yet. However, I will share with all of you that the prospect of me getting a heart is imminent, and I might get that very, very soon, within the next coming weeks, as a matter of fact.
Wow.
So, yeah. So that's news I'm sharing. Now, it's not definite because these things are not definite. The right heart has to come along. The good news for me is I'm not an emergency. I can wait. I can live like this for quite a while. And if it turned out that I would get the heart in 6 months or a year from now, that would probably be all right too. But I'm ready to make that next step. I've made the decision to do it. So if I get the opportunity, I will go forward with the heart transplant.
Wow. Thank you so much. Thank you
Sure.
very much for sharing that. I appreciate that. And obviously we all wish you luck, and hopefully that this heart will be a strong, wonderful heart, and you'll live a very long and prosperous life.
Yeah, thank you.
I want to switch gears a little bit and talk about the pandemic. Your team supervisor for the New York Contact Tracing Initiative. So I'm not sure what that means. So
Yeah.
please tell me and tell us all exactly what you're doing, what that means.
Yeah. So if we roll back to April or so of this year, we realized that there was always contact tracing going on, by the way, in New York State, but it was for other lesser known viruses. So they do have that department. But Mike Bloomberg, I think, formed an initiative. He was behind the financing of an initiative where we would have a contact tracing program in New York State. And so jobs came available. Now, the reason I took advantage of that is because my speaking engagements dried up, given that we couldn't have any gatherings anymore. So my wife actually noticed the offering on TV, and she said, we should maybe apply for this job. It's something you would probably like to do. I like to keep busy. I'm just not someone who likes to sit still. I can't imagine myself just staying home, even if it means golfing. I can't even golf that often, so I can golf I only have the strength to golf a couple of times a week, so I couldn't do that. And I don't like going to the supermarket. And I wanted to continue to share my knowledge and my experience with others, because I get a kick out of people learning what I have learned, and I like sharing it. So this opportunity came up. I applied. So the application asked for somebody
so just a quick question. As I hear you, it became a great opportunity. But what exactly are you doing? So tell us all what it's all about.
Yeah. So what it ends up being is a supervisory role, which is what fit for me the best. So there are, just to give you an idea, right now there's about 900, 1,000 contact tracers in Long Island, Nassau and Suffolk County. There's about 60 supervisors. I'm one of the supervisors. And so I run a team of about 20 contact tracers. And we call people who have been contacted by somebody who is positive for the virus.
Okay.
And so I supervise, that is, I help our contact tracers with problems they have communicating with those contacts, getting them to understand the importance of quarantining. We shape the system for best ways to make sure we're taking care of as many people as possible in this initiative. And mostly we're trying to make sure that people are staying safe, that they're not transferring the virus, that they're not getting more sick, that they have the things they need, like food and shelter and medication, and that can be delivered to them, and New York State can help them in that effort.
That's great.
So we guide the people that are willing to listen to us to stay safe and not transfer the virus. And so we are making recommendations. We are not an enforcement group. We do have communication with the local health department. And so if we feel that enforcement is something that is necessary or called for, we communicate those situations to local health department and Department of Health in Albany, and they take care of that as far as enforcing it. It's grown so much because now we are also obviously also quarantining the people who come in through the airports. So everybody who comes into New York through JFK and LaGuardia and the Long Island airports must fill out a form stating that they have either been tested or not. And if they're not, they have to be quarantined. If they have had a negative test, they just have to quarantine for a few days, get another negative test, and then they're free to go. But it's complicated because there are repeated exposures in households. Some households have 8 people living in the same house. And then there are the schools. So we are the people that look over the people who have to be quarantined in schools, students and teachers. And sometimes we have to close the schools to in-person learning.
So let's talk about schools specifically. What does it take to close a school, for example?
Yeah, so there is a critical number. Last I heard for a college, for example, it's 100 positive cases in a 2-week period. So for a school, let's say Oneonta, which was one of the first ones we closed in New York State, that would be the number. But quite frankly, if there's just a one positive case, then quarantining is called for. So we will notify the people who have been in contact with even one positive case, and we learn of the positive case through the Department of Health. It gets put into our system, so we are knowledgeable about who that case is. Interestingly, HIPAA does not allow us to reveal or acknowledge to the contacts who the case is. And so that gets complicated too.
Is it different in the high schools, middle school, low schools? Is it different there, or is it similar type of tracing?
No, the rules are the same for everybody. The rules are the same for everybody. The travelers have different set of rules. All of the quarantine rules are set upon to us by New York State, and we follow the New York State guidelines, which are similar to the ones that you hear Andrew Cuomo talk about. I mean, he's pretty much on track with what we do.
So speaking of Cuomo, yesterday he said there's new phase of war against COVID. I quote him, that the focus is going to be more on hospital capacity, not necessarily test results. What's your thoughts on that?
Yeah. So the interesting thing, one of the interesting things about this initiative and my role in it is that things change all the time. The rules keep changing. This virus is so mysterious that we go from one day, 1 week to the other, and things shift. So now he has a new focus, hospitalizations. His concern, obviously, is are there enough nurses and doctors to take care of the people that are coming in with COVID-19? I understand that there's a hospital in the South Shore of Nassau County that just closed to everything except for COVID cases. So
Wow.
if you have an emergency, you can't go to that hospital now. South Nassau, that is. I heard that a couple of days ago about South Nassau. So again, these hospitalizations are ticking up. I think that's the ultimate concern. Now, they have found better ways in the hospital to treat patients that are coming in with COVID-19. So I think you get a lot less deaths from it. And those deaths are probably mostly much older people that have comorbidities, heart disease, lung disease, and such. But so the younger people may have symptoms, they may not have symptoms. Hospitalizations obviously are people that have symptoms. But I think the treatments are better now in the hospitals than they were before.
Well, once again, if you have a question for Dr. Gary Sherman, you can email me at mkravitz, Kravietz, at alignwealth.com. Align is ALINE wealth.com. So if you have a question about congestive heart failure, about tracing that Dr. Sherman's doing, feel free to email me. So going back to the questions, it seems like New Yorkers are behaving, wearing masks, social distancing. Why are the numbers increasing like they are?
So most recently, and we were doing great, and we're still doing great relative to most other states.
I think so.
Because of the fact that we did buy into wearing masks, social distancing, washing our hands, and that's your best defense. In addition to that, we have contact tracing. The system in New York is better than any other state, and the system in Long Island is better than any other counties in New York State. So we are way ahead of the curve. But the uptick now was a result of cooler weather, Thanksgiving, Christmas and Hanukkah coming, New Year's coming, holiday time, indoors, gatherings. The virus loves gatherings, it turns out. I'm not a scientist, but if I go by the science and what they say, the virus seems to love gatherings. The more gatherings, and that's what we find in contact tracing too. We find similar addresses, different people coming up with positives, and we know that something's going on there. It's usually a party or a school or a gathering of some kind. Some of the gatherings in New York you might have read or heard or seen on the computer are very, very large gatherings, weddings that shouldn't be taking place with tens of thousands of people attending. And those types of things just spread the virus. So that is really the reason for the increase in the percentage. I think it's gone up like above 3.5%. It was down as low as 1.2% at one point.
Yeah, I think we're over 4%.
Yeah, or over 4%. So that's significant now. And in some states, it's over 10 and 15%. So we know relative to other states, we're doing good. But yeah, this is about COVID fatigue. This is about people not seeing their relatives for a long time, and they just want to go, and they break the so-called rules of trying to control the virus. The problem is the virus does not know the rules, so the virus continues to spread as long as we continue to gather. It's very difficult to stay away from our relatives and so forth. And it's difficult, by the way, don't blame the college kids too much. You know, we look at that and we say, oh, they're partying together and so forth. It seems as though the development of the mind for college age people, 19, 25 years old, it's important for them to be around their friends for their maturity. That actually scientifically is the case. And so they need to have their friends around them at that age specifically. And they feel very bad about bringing the virus home to their grandparents. So they are under a lot of stress with this as well, not necessarily to be blamed. So that's an interesting fact also about this thing.
Yeah, that's I can really appreciate that. I can really understand that, and again, talking about Cuomo, he was talking about micro cluster initiatives. Are you familiar with that?
So I just know about clusters, certainly, because we deal with clusters all the time in the initiative. He's trying to put out little fires, if you will. It's not the same all across the state. So you might have 90% of the people doing exactly what they're supposed to do, but then you have these little areas where people are not following the rules.
Mm.
And that's where he's enforcing the rules more strictly. He's closing those restaurants. He's attempting to close those places of gathering. Certainly, we know that there's a new law that superseded what he was doing with regards to religious gatherings. And so, that's something that, is worked out at that level. The virus, as I understand it, is an atheist. I don't think that it's a religious issue, and I don't think it's a political issue. I think it's an issue of gatherings and trying to keep everybody safe. So wherever they're breaking those rules, and I use the rules loosely, I mean to say the right thing to do to be able to control the virus from the science, then those areas are the ones that he's coming down on the hardest, and those are his microclusters.
I guess the good news is that we have a solution to this, the vaccination. I watched a interview yesterday with the president of Moderna, and he talked about that vaccination and how it's almost 95% sure that it works, and they're trying to get that out or pump that out as quickly as possible. So between that, Pfizer, AstraZeneca, we have hopefully a solution that's coming, and could be even within weeks of people starting to get the vaccination. So that's the good news there. Gary, I do have one question coming in. Question was talking about the future of artificial hearts. Your thoughts on the future of artificial hearts?
Is my audio still okay?
Yeah, you're okay. Yes.
Okay, good. Thank you. Yeah, so with the studying that I've done, the artificial heart is being developed by companies right now. FDA approval on all that, on those types of things, takes a long time. There will be an artificial heart in the future. I have the LVAD, the newest iteration of it, as I understand it, and my batteries are external. I wear them in a vest when I play golf, where I'm going out, or I wear them in a sort of a fisherman's thing when I'm home. It's easy, it's just more comfortable. But they're big. They're 5 pounds each on either side of me, and the computer I keep in my pocket in my pants. It's certainly convenient enough. But in 5 years from now, the batteries will be inside. There's always progress. I always like to think of myself as just part of the progression of treating heart failure. I'm just part of history. If I can step outside it like that, I know that it's going to get better. I know that the devices, they'll laugh at my device 15 years from now, that I wore big batteries on the outside. And so I'm certain that there'll come a time where they have a totally artificial heart. They can take the heart out, put an artificial heart in, and it might last 150 years. So the progress is continuing to be done by companies like Abbott, by these kind of companies that do develop these devices. And the future is all positive. I'm in touch with my surgeon. I know he's part of some of the studies that lead to some of these advanced ways of dealing with heart failure. And everything will get smaller, everything will get more efficient, everything will get better as the years go on.
That's great. Well, Gary, you said it all. I want to thank you, and a heartfelt thank you to you. I want to wish you good luck. I hope that the heart comes in the next couple of weeks, and you get the new heart. And I look forward to playing some golf with you with your new heart. So I really appreciate that. And again, for everybody, thank you for today. Thank you for watching today. Our next Coffee with Krav will be January 5th. with Jack Manley. Jack is a global market strategist with JP Morgan. I thought it'd be a good idea at the very beginning of the year to have a global strategist so that we can talk about the markets, talk about what we should expect. Jack is a frequent CNBC contributor, so I think it'll be a good far-reaching conversation. So in this season, I'd like to sign off by saying to you, find a blessing, find something that you're thankful for, and also be a blessing. So thanks a lot. Take care. Happy and healthy new year. Let's wave goodbye to 2020 and say hello, 2021. Take care. Bye-bye.